benign prostatic hypertrophy, BPH. The prostate is a walnut-sized gland located between the bladder and the penis. The prostate is just in front of the rectum. The urethra runs through the center of the prostate, from the bladder to the penis, letting urine flow out of the body. The prostate secretes fluid that nourishes and protects sperm.
Fluid called prostatic fluid, a component of the seminal fluid.
During ejaculation, the prostate squeezes this fluid into the urethra, and it's expelled with sperm as semen.
Another function is to push, propel this seminal fluid into the urethra during ejaculation.
Enlargement of the prostate gland is common as a man ages.
50% of men show signs after the age of 60. 90% of men show signs after the age of 85.
And occurs due to non-cancerous multiplication of the prostate cells. As the prostate enlarges, it compresses inwards into the urethra or urine channel, obstructing the flow of urine out of the bladder. This obstruction occurs not only because of physical enlargement of the prostate, but also because of increased numbers of muscle fibers in the prostate and/or increased tone in these muscle fibers. These muscle fibers have a gripping or squeezing effect around the urethra. Obstruction of urine flow causes symptoms of a reduced urinary stream, difficulty starting the stream, and poor bladder emptying. Also, as a result of obstruction to urine flow out of the bladder itself has to work extra hard to empty. With time, the bladder muscle can become thickened and more sensitive, and the ability to hold large amounts of urine decreases. As a result, one might have to empty the bladder more frequently, and might have stronger urges to urinate. When left untreated, BPH can lead to total inability to urinate, called urinary retention, which requires insertion of a tube into the bladder, or catheterization.
Complications of untreated BPH rare. We used to let the patient wait and see. The most important of them is urinary retention, incontinence, renal insufficiency, recurrent urinary tract infections, urosepsis, gross hematuria, bladder calculi, bladder diverticula, and kidney damage. Indications for treatment.
Bothersome symptoms which affect one's lifestyle. Worsening symptoms where one is at risk of progressing to a more serious situation, and unwanted consequences of obstruction, including urinary retention, infection, kidney failure, bladder stones, and bleeding.
Patients who are at high risk are those with very large prostate, very elevated PSA, symptoms are very severe, bladder is very poor, urine stream is very weak.